Perthes disease is an idiopathic avascular necrosis of in a children, possibly due to anatomical variation with ischemic events and causing problems. The incidence is 1 over 1,000. The risk factors is family history, social deprivation, regarding the patient can sometimes be overweight, complaining of pain in the hip or the knee joint with a Trendelenburg gait. The age is 6 to 8 years of age. Boys are most commonly involved, but the girls, when involved, is worst prognosis. It is classified as Waldenstrom's classification, which consists of sclerosis, fragmentation, reossification, and remodeling. The total tie duration, it has been quoted as 18 months. Regarding any patient which comes with a hip pain or the knee pain, an X-ray would be indicated. An X-ray would show, can be classified into Herring classification. The Herring lateral pillar classification is basically a classification which quotes the height of the lateral pillar. Type A is when the lateral pillar is normal height. Type B is when the lateral pillar height is more than 50%. And type BC is another addition which states the lateral pillar level about 50%, but the middle pillar is involved more than the lateral pillar, and type C is less than 50% of involvement. Herring also later on reclassified into group of stages or group of patients who will need surgery and will not need surgery, and the prognosis. So age factor is 8, and in some papers it's 6, written as 6 is the cutoff. So a Herring A, any age group would be managed conservatively and would have good results regardless of the treatment. In Herring B, less than 6 years would be going down the line of conservative measures with good results, while Herring type B and age more than 6 would need operative intervention. Herring type C, if they are less than 6 years, do better with surgery, and Herring type C, which is more than 6 years, would do worse irrespective of what form of treatment we have given. Added risk sign for Perthes disease are clinical signs and radiological signs. Clinical signs is female, obese, older age, bilateral, and stiffness. Radiological findings is gauge sign, which is a V-side type of lucency, a lateral aspect of the X-ray. Horizontal physis, speckled calcification, cyst formation, and these are the findings which needs to be, and subluxation of more than 2 millimeter. Regarding the treatment of leg calf Perthes disease, it depends on the age, lateral pillar classification, and the risk factors. All these factors this will decide my management. If the child is less than 6 or more than 6 with no head and neck sign, I would not go for surgical intervention and manage conservatively. I can understand the previous historical use of Petri cast, broomstick cast, and abduction orthosis utilized. There is a difficulty with compliance in such things. Avoidance of sports and offloader brace are not easily accepted in this age, and thereby I will have a close follow-up. In a child of stage B, less than 6 years, or stage C, if stage B more than 6 years and stage C less than 6 years, I will prefer operative intervention in case head and wrist signs are there. Anyhow, my main goals is number 1, relieve the pain. Number 2, contain the head. Number 3, keep the range of motion. Number 4, prevent osteoarthritis to develop. The operative intervention in the form of either pelvic osteotomy or a femoral varus osteotomy. The pelvic osteotomies can be a Pemberton or a Salter in nominate osteotomy, or in salvage cases, it will be a Chari or a shelf osteotomy. Regarding if there is a hinge abduction, I might need a valgus osteotomy. I know orthodiostasis have been done, which affects, which improves and offload the hip joint and improve the development of the hip. I don't have any experience of that itself.